So COVID-19 has indeed been devastating for the African region. Although mortality has been lower than the rest of the world, the pandemic has exacerbated systemic deficiencies that lead to extreme economic and financial vulnerability, threatening to halt the progress that has been achieved during the past 2 decades, if not even to reverse it. Although COVID's impacts cannot be confined to just one area, our deep dive diagnostics and data collected show that there are mainly 3 areas that Africa cities seem to be struggling the most. The first one is the very high levels of informality. And in many African cities, informal workers account for over 90% of the labor force, with unfortunately more women employed informally than men. So it's crucial to make strides towards formalization of the economy and creating links between the informal and the formal economy. It's also important, however, to make sure that social buffers and social support schemes, such as social protection programs, also reach and cover informal workers. Now, second, in terms of businesses, it is apparent that small and medium enterprises cannot build protection against economic shocks and crises, such as the current pandemic, because they do not have adequate access to credit and finance. Without provisions towards that direction, small and medium enterprises that represent the vast majority of businesses in the region are likely to be hit the hardest in future crises. And third, a third challenge that makes Africa cities extremely vulnerable is the lack of adequate and meaningful fiscal decentralization. Local governments, although at the forefront of combating the pandemic, have very limited capacity to raise revenue, retain it, and use this revenue for rebuilding processes and for building resilience. Expanding municipal fiscal space, therefore, is an area for increased policy-making focus. Africa is currently experiencing the most rapid urban growth in the planet. The urban population increased more than tenfold during the past 6 decades, from just 53 million to 588 million during the period from the 1960 to 2020. African cities are, of course, the epidemiological foci of COVID-19, like other urban areas globally. However, the quality and nature of Africa's urbanization really exacerbates transmission rates of infectious diseases like COVID-19, and makes containment and response measure considerably more difficult to implement. In order to promptly and adequately address the challenges of COVID-19 pandemic and other economic crises that are bound to reoccur in Africa at the urban scale and through local governments, policies and programs should not aim at an ad hoc or damage control and mitigation efforts of the negative effects of the pandemic and other crises, but rather on longer-term solutions that build strong urban economic resilience. For sustainable cities in Africa, it's important that local communication and community engagement strategies are employed. Support to small and medium enterprises and the informal economy are also a make or break arrangement for the region. Deepened decentralized responses to crisis through strengthening local government capacities will also be catalysts in building a resilient urban future in Africa.